and welcome to our Monday Minute. Today we're going to review the newest release of the Home Health Value-Based Purchasing Interim Performance Reports, or IPRs. The most recent interim performance reports were released in April, toward the very end of April actually. This installment of the interim performance reports includes data, measure calculations for the OASIS items through December of 2023. So technically, this should be your results for OASIS measures that contain a full year of 2023. The items related to claims and the items related to the CAHPS surveys still only go through September 30th of 2023. We will receive another installment of the IPR reports in July, August, and then we will receive the initial preview report for the entire year of 2023, which will then contain all measures January through December of 2023. Once that initial preview report, annual report, is released, you will need to immediately request a recalculation of your numbers if you feel that they are incorrect. You will have to have supporting documentation as to why you are requesting a recalculation. They won't just recalculate it because you have requested that they do so. You will then submit the information that challenges the scores that you have received, and of course subsequently receive a response. They will also release the preliminary report that will show the calculations, and you will have a chance to request a recalculation from that as well. If you do not request a recalculation of the preview report, you will not be allowed to request a recalculation of the preliminary report. We will not get the final report to know exactly how payments are going to be directly impacted until later in the year, probably closer to November, December. Once those final reports have been released, it will show the payment impact you will receive in your 2025 payments, ranging somewhere between a -5 and a +5%, typically with the calculations, the way they've been made, ranging probably closer to a -3.5% to a +3.5%. It is imperative you continue to follow these reports and continue to analyze the individual measures that you need continuously to work on to improve those scores as we continue through 2024. As we enter 2025, we will see some significant changes to the value-based purchasing measures. One of those specifically including that the GG items will now be utilized as one of the significant pieces of the total performance score in the calculation of the discharge function score. The discharge function score being based on the GG items, what many people have not quite realized is that the measure calculations are based on start of care to what the algorithm calculates is the discharge, or should be the discharge status of the patient. So the calculation of the outcome measure is at discharge. And many of the patients that will be discharged January 1st, 2025 or later may already be on service at a home health agency. My point, waiting till the very last minute to do GG education with your field staff who complete OASIS, not a wise decision. Starts of care that are happening now, and definitely ones that will be happening in the third and fourth quarters of 2024, can be a direct impact on the discharge function score, as it will be calculated as these patients are discharged, and especially the fourth quarter 2024 patients being discharged January 1st or later. So ensure that you are getting that GG education done and done immediately, so that you are not only impacting the 2024 baseline year that will be used eventually, but you will be impacting already the results of your 2025 outcome measures. Thank you so much for listening today. If you need assistance with analyzing your value-based purchasing reports, or you need assistance in education with those GG items on OASIS, Healthcare Provider Solutions is here to assist. Thanks so much, and let us know if we can help.